Hello and welcome to Sounding Board. My name is Renee Roberts and I'll be your moderator for today's program, which addresses the topic of single-payer health care. But before I introduce my guest, I'd like you to know that Sounding Board is a project of Seroptimus International of Novato. And Seroptimus is an international organization whose mission it is to improve the lives of women and girls locally and globally. My guest tonight is Ellen Karel. She is the co-director of the Marin chapter of Healthcare for All, California. Ellen has been involved for several years in efforts to educate the residents of Marin County about the potential of a publicly funded single-payer healthcare system. This should be a very interesting program, and hopefully will answer questions that we all have about single-payer, how it would work, how it differs from the Affordable Care Act, and why there is growing support among healthcare professionals and the public for a single-payer system. Welcome, Ellen. It's nice to see you.
Thanks, Renee. Nice to be here, and I want to thank the Seroptimus of Novato. I was going to say that it's very appropriate that we're talking about healthcare in the context of a Seroptimus Club presentation, because the first Seroptimus Club, as I understand it, was founded in 1921, which was in Oakland, here in the Founder area. And it was founded 1 year after women won the vote, the right to vote. Right. And of course, Seroptimus is all about empowering women, enriching them, protecting them, and that's what healthcare and universal healthcare can do. And also I'm reminded of the women's movement, which took so long to achieve its goals, with Susan B. Anthony dying in 1870 after spending her whole life fighting for women's rights, and having the vote come 50 years later. So hopefully we've already done a lot of that work, and we're going to get to single payer sooner. So I'm real happy to be here. Good,
thank you, that's great. Well, you've been an active volunteer with Healthcare for All in Marin for almost 8 years. What drew you to this issue, and why have you kept at it?
Well, it's interesting because I'm an educator. My career has been in teaching, although I do have a sister who's a nurse, and I hadn't been necessarily drawn to healthcare issues. However, about 8 years ago, a friend of mine said, "Oh, why don't you come to this meeting that I'm going to?" And I went, and that changed everything. This was a citizens' congressional hearing on healthcare that had been arranged by a woman named Esther Wanning, who had founded the chapter of Healthcare for All Marin and had worked hard to found a statewide organization for single-payer advocacy. And I went, and there was a panel of experts who were very interesting, and there were several members of the audience who told very sad and shocking stories about having problems with accessing healthcare, paying for it. But I have to say it was Mark Leno, who was an assemblyman then and who is now a senator and has since introduced single-payer legislation twice, who really put it in context for me and brought me to tears. And honestly, when I think of that day and the way he talked about the importance of healthcare, I still tear up. Because what he was talking about is how important healthcare is in our lives. It's fundamental. And it sounds obvious, but it's true. And there are different factors that affect our health. Genetics and socioeconomic status are biggies. Access to healthcare is a smaller one, but nonetheless important. And most importantly, it's something we can actually do something about. And so if we have it within our power to relieve families of the pain and stress and agony that they are suffering from not having easy access to health care, then we should do it. And by doing that, we can open up other avenues for people to live their lives.
That must have been a very powerful experience for you.
It really was. You just see how it relates to everything.
Yeah,
and
right.
Yeah.
Well, Here's the big question. What exactly does single payer mean?
Single payer, you know, I've spoken to clubs and I've said, how many of you have heard of single payer? And almost all the hands go up. And then I say, well, how many of you feel that you could explain single payer to your neighbor or your friend? And all the hands go down. So thank you for the question, and I hope I can explain it in a way that people will feel comfortable talking about it. Single payer, the single payer, an entity that pays our bills, is a component of a coherent universal healthcare system. And in this system, a single public health agency manages all the money that comes in and goes out. And by simplifying the administration and the payment of health care, we are able then to extend health care to an entire population. So it's a single payer system is deliberately designed to be able to make health care available to an entire population. And that could be an individual state in our case, or it could be our entire country. So single payer refers to a system of financing and administering health care. Basically, that's what we're talking about.
And so can you explain how a single payer system works?
Yes, I certainly can. Here's how it works. The way it works is a single public agency is set up, and it performs 4 functions. It's the functions that we need to be able to finance and administer a program. It collects all the money. It negotiates prices with all the healthcare providers, with the drug companies, with the medical device manufacturers, so that we can have rational, stable pricing and controls in that way. So we collect the money, negotiate prices, and then the single payer defines one comprehensive health benefits plan for everybody. And lastly, the single payer pays all the bills. So the administration and financing is extremely simplified and cost effective. And this is how we are able to have the money to pay for everybody. And just to give you a little more detail on each one of those, because this is where it differs so much from what we have now. The single payer collects money from the 3 sources that are now paying for health care, but in a different way. We individuals, instead of paying premiums and co-pays and other deductibles and out-of-pocket expenses for things that are not covered, instead of paying to directly for health care or for our premiums, we pay a set percentage according to our income into the health care fund. Employers, instead of shopping around for policies and changing policies to get a better deal for their own employees, pay a set percentage of payroll into the public fund. So individuals are paying in, employers are paying in. And lastly, government, which today basically is responsible for up to between 40 and 60% of healthcare costs. The government will pay into that central fund also. And instead of having an array of all these public funds with different eligibility requirements and ways to register, instead of having Medicaid for the poor and Medicare for the elderly and other kinds of government programs, all that money goes into the central fund. So that is how we collect the money, and that's where it's pooled together. So that's the collection of the money. The negotiation is done with groups of physicians and healthcare providers and manufacturers, drug companies. We pay much more for drugs than all the other countries do, because other countries, of course, negotiate prices. So it would negotiate prices on behalf of all of us. Comprehensive benefits. The benefits plan is completely comprehensive, including dental and vision. Now this is how it's been conceived. There have been studies, including the cost of the 10 essential benefits that now the Affordable Care Act includes, because under Obamacare, as it's called, we're finally getting to see what real insurance looks like. So it would include all those benefits plus additional services. So it would be a comprehensive plan. Not everybody would use everything, but Those are the things that would be included in the plan. And then lastly, payment. And this is where the savings comes from, the collection and the payment. We would all get one card. We would go to the doctor. They would swipe the card. The doctor would bill the single payer. The single payer would pay the doctor. And that is, as you can see, much simpler than having hundreds of plans and having different kinds of things covered in different plans and having prices varying widely. So
everybody would have a different deductible. I mean, that's the way it is now.
Right.
And so it sounds awfully simple.
Yeah.
So uncomplicated.
That's right. That's right. And it's fair.
Yes.
People are paying something that's comfortable. It's prepaid. You're not stressed out wanting to know how much something's going to cost when you finally do go to the doctor, or if you're going to be able to afford it. Yeah. And we all understand insurance. This is insurance, but instead of private for-profit insurance, this is public insurance. And all money that comes in goes for health care. There isn't money that is siphoned off for other things that have nothing to do with health care.
Wow. Boy. That was
pretty exciting,
a good explanation. Yes, yes. So how is the Affordable Care Act, otherwise known as Obamacare, how is that different from single payer?
So, the Affordable Care Act was the first major effort to respond to the increasingly tragic healthcare crisis since 1965, when Medicare and Medicaid were implemented. We did have a chance back then to make it Medicare for all, which is what we want now, but it didn't happen. And so this is and things got worse. And so now we have an opportunity. President Obama took the initiative to do something about the health crisis. Instead of going to a single payer system, what people did, and even people who supported single payer said, well, this is all we can get, it's what's politically feasible, was to maintain the same elements that we have had in the past. So to maintain private insurance, to maintain an array of government programs, but to try and make them better. And the thinking was that people who have insurance have better health care outcomes. So let's just try and extend insurance and get more people insured. And so what the Affordable Care Act does, it does a few things. And I'd just like to go through that because people may be unclear about this. I wrote a few things down. For one thing, it implemented insurance reform. So the worst abuses of the insurance industry were reformed. And these are extremely important and a very positive outcome from the Affordable Care Act. They established 10 essential benefits that all plans have to have. So that you can't be paying a lot and not knowing what you're getting and not being covered for something when you finally need care. Everybody has to be insured. There's no pre-existing conditions anymore. They can't drop you if you develop a certain condition. They can't charge you more because of your health status. Right. They can only charge more for a couple of things, a little bit more because of age and also according to geography. There are no annual or lifetime limits on coverage, and in fact there are limits on out-of-pocket expenses. Those are all really good things, and they close up the Medicare drug donut hole somewhat. That really doesn't mean that insurance is going to be affordable for everybody. Right. But it does at least reform and those kinds of abuses. Now, basically what it does is it tries to go after those 50 million people who are uninsured. The idea is let's get people insured. And there are two ways that people are insured under the Affordable Care Act newly. One is the expansion of Medicaid so that people qualify at a higher income level. And so that's the government direct payment for health care for people at the lower economic range. and it establishes a marketplace for individuals. Individuals before were out there on their own trying to get health care, and it was very difficult. So you have these exchanges, and the states have these different plans that different insurance companies can offer with different deductibles and coverage. So that's basically what it does. So you have more people insured, and you have insurance companies not able to do the worst things that they were doing. But millions of people are going to be left out. We see that with the Supreme Court ruling. A lot of states are not extending Medicaid. It is, as we have seen, incredibly complex.
Yes.
And it's this complexity that in the end costs a lot of money, creates confusion, and creates holes in the whole system. So long-winded way to answer your question, I'm sorry. What the Affordable Care Act does is it tries to take the existing system of private insurance companies and rein them in a bit and subsidize them to help people get private insurance, as well as directly funding people for insurance. Single payer is very different from that.
Yes.
It eliminates the middleman. It eliminates the private insurance companies. They are no longer in the driver's seat taking us for a very bumpy ride with a lot of people being thrown out of the vehicle.
Right.
And being very sore when they get there. So you have to understand why that's important. When you have private insurance, you have profit being taken, you have high CEO salaries, you have lobbying, you have marketing and advertising and packaging of plans. And all of this adds up to money. What is the most costly, however, is the actual administration of all these plans. The billing clerks at all the doctor's offices, the billing clerks at the insurance, and figuring out what is included and what's not. All of that is part of private insurance, and it's been estimated that that takes up from 30 to 50% of each healthcare dollar. That's for administration, financing, things that don't even fund that. So in a single payer system, instead of us going through this middleman where money is automatically taken out, our money goes directly to a fund which pays for our health care. So that's the basic difference between
So, who would benefit from a single payer?
I'm so glad you asked. Well, we value freedom and security in this country, and we would have a whole lot more of it if we had a single payer system. Yes. First of all, of course, individuals would be vastly benefit, individuals and families. For one thing, you would have freedom to choose your own doctor. With all the doctors in the same network, you can go to any doctor you want.
Correct, sure.
I just saw something from one of the insurance companies that said, you have free choice of doctor within our network. Well, the network is everybody, because that's how it would work in a single payer. So you have free choice of doctor. The other thing for individuals is you have freedom to change jobs without losing your health care. That's extremely important. Imagine how many people are getting jobs and clinging to jobs because of the health benefits.
So right,
And so those are two things right off the back. Obviously, freedom from stress, freedom from illness, freedom from bankruptcy, the security of not having the possibility of going bankrupt, or choosing between food and medical help. So you have that security and that freedom as an individual. You have health care. Now, employers are helped because they, they are able to economize on what they're spending for health care. For one thing, it will be cheaper. But also they don't have to hire, in their human resources, they don't have to hire people to go out and to look for these plans and to change plans and that kind of thing. They'll have a stable the stable expense in their health care. They know what the percentage of their payroll is, and they can plan ahead. There's an even playing field among employers because everybody's employees are covered. And so there's a healthier workforce, so the employers are helped. The economy in general, of course, is helped because now the amount that we are putting into healthcare is reaching, it's 18% reaching 20% soon of GNP. Mm-hmm. And that's money that we're putting in, not getting something, what we need back from, for one thing, but it's money that's just being devoted to one sector of the economy when we have other things that we need. And taxpayers benefit enormously because right now what's happening to our communities is when you consider all the public services that we depend on for the quality of our life, our schools, our police, our fire, our libraries, our roads, our transit, all of these employ public employees, and that's our tax dollars. And these public services are paying private insurance prices for public employees. And so that is draining all the budget of our community services. We're cutting back. So if that were not the case and we could economize on the health care benefits, then you would have, we would not be seeing the cuts in vital services that we're seeing.
Yeah. Boy, it's such a big topic.
I know.
I so much more time. What do you think it's going to take for more people to support single payer?
Mm-hmm. That's a very good question. That's a key question. We always see ourselves, going up to the tipping point, mm-hmm. And then over it. For one thing, we should know that there is a lot more, tremendously much more support today for single payer than ever before in our history. Mm-hmm. It's interesting to note that back when Social Security passed in '35, and then later when Harry Truman was putting out the fair deal, wanting to put out a fair deal with national health insurance, it was the AMA, it was really the doctor organizations that fought. That fought it. Oh. Today, polls show that 59%, well over half, and among some of doctors, support single payer. And of that 59, almost 60%, you have a much higher percentage of some groups of doctors, such as primary care doctors. Mm-hmm. So there is support now from the doctors. Yeah. And there's certainly more support from the public. When people are asked, do you support a Medicare for all kind of program? Would you support higher taxes for universal health care? Majority say that they would. That doesn't necessarily mean that our public officials who are beneficiaries of campaign contributions, mm-hmm. Or who are afraid of being challenged by candidates who are opposed to single payer, are going to get out there and lead in this. So what it takes is everybody, everyone tell everybody, spreading the word, educating, putting the facts out there about what this is and how it can help, and that's what we do. Mm-hmm. There are the healthcare for all. We table at markets. We hold screenings of the healthcare movie on the Canadian system and that kind of thing. So there's a lot that can be done. You can have a house party. You can invite people over. You can lobby your legislator. And there are many organizations that are supporting single payer throughout the country, mm-hmm. and you should get in touch with one and see how you can help. Yeah.
So why would people oppose single payer? And what do you say to them?
Why indeed?
Probably, I know you'll have to give me the 2-minute version.
Okay,
probably.
I'll try and condense this. Yes. Why would people be against it? First of all, you entrenched economic interests. You have the corporations that are making money from the system, mm-hmm. and it's their interest not only to maintain the status quo, but to convince other people of it. And Mark Twain once said, "It's easier to fool people than to convince people that they are being fooled." And this is a little difficult. Mm-hmm. We're in a very polarized political environment, and we need to open up and start listening to each other. So, I'm sorry, I forgot the question. The question is, why are people opposed to it? Okay, so we hear these arguments. All right, the biggest argument: can you trust government? You can't trust government. Well, there's been a lot of rhetoric around how we can't trust government, and therefore people are applying that to the healthcare. Well, we can trust government. We are the government. We are a democracy, and we need to have government of, by, and for the people. And if we can't trust ourselves, well, we're in big trouble. So the point is, government right now runs Medicare. I don't see anybody giving up their Medicare. Medicare runs with 3% of overhead, and serves everybody very well. We have the VA, which is very well run, which is has a lot of support. So already government is running in terms of administering and financing healthcare. We have government schools. We have schools. We have fire. We have police. These are what you call socialized kinds of services that we value and we depend on. And the mail gets delivered. Government can do a lot, and it should do something like this. So that's one thing. The other thing is, why should I pay for somebody else? You hear this from people who are healthy and say, I take care of my health, why should I contribute to somebody who isn't? Or somebody who says, I work hard, why should I give health care to somebody else? Well, that's one way of looking at it. Basically, insurance is about paying for others so people will pay for you. That's what insurance is. And so there's...
I know. We could have gone on and on and on. This is such a great topic. And Ellen, I just hate to stop, but we have to. Thank you so much for being here tonight. I also want to thank our crew from Seroptimus of Novato that helped produce tonight's show, and also to Rick Tucker and Leon Johnson. Without their assistance, this program would not be possible. Also, at the very end of the show, please enjoy a little song by Ellen Karel. It has to do with single payer. Thank you very much. Good night.
This plan is your plan, this plan is my plan. From Mendocino to Escondido, healthcare for all is all we're asking. This plan was made for you and me. Oh, single payer, it is a great plan. It covers health care throughout the lifespan. The status quo, whoa, it's gotta go. So, this plan was made for you and me. Billions will save on administration. We'll lower costs through negotiation. With what we'll save, we'll treat every patient. This plan was made for you and me. We've got the money, don't doubt it, honey. But so much flows to insurance companies. We'll pool our wealth, we'll invest it in health. This plan was made for you and me. It covers dental, it covers vision. It for our children and men and women. No need for co-pays, farewell deductibles. This plan was made for you and me. It's all-inclusive, it's universal. It really isn't so controversial. Now we pay more for less. We're tired of this mess. This plan was made for you and me.